Good afternoon again. It's Friday, April 4th. You're in the Senate Finance Committee. We're going to do 2 concurrences with Amber, and then we're going to do some voting. Amber?
Thank you, Madam Chair. The first on your blue sheet is a list of 2 bills. The first is Senate Bill 4, which is an emergency measure that alters the composition, powers, and duties of the West North Avenue Development Authority. The House amendments conform the Senate bill to the House bill as it passed the Senate. A motion to concur in this case would be appropriate.
Senator Hayes, would you like to make the motion?
Yes, ma'am. Move to concur.
And who would like to second that? Senator Washington. Okay. All in favor of the concurrence on Senate Bill 4? Thank you very much. Senate Bill 4, and today is 3 days before the end of session, and we finally voted it out. Thank you.
On
Your only bill? Is that your only bill?
More than that.
Senate Bill 4 on 4-4.
On 4-4.
There we go.
You're so sharp.
The next bill is House Bill 78. It's a departmental bill that requires the State Commission of Real Estate Appraisers, Appraisal Management Companies, and the home inspectors within the Maryland Department of Labor to submit a report by July 1, 2028, and extends the termination for the commission until July 1, 2029. The Senate amendments conform the House bill to the Senate bill as it passed the Senate. Basically, in this case, we have advanced the termination date until July 1, 2029, or the committee did, to encourage the submission of the report that's due July 1, 2028. The House has delayed that termination until 2031. We have not agreed with those amendments, so a motion to not recede in this case would be appropriate.
So move.
Not received. Do I have a second? Not received. Senator Lamb, not received. Okay. That's done then, right?
That is,
So next we have, are we going to go to Nathan?
I'm
No.
going to start with,
You're gonna
skip
start.
Nathan's bill, and I will continue, and then we'll move to David, and Nathan has requested to go last.
Okay, so Amber, you're going to do House Bill
Bill-
128.
Yes, ma'am. House Bill 128 is identical to Senate Bill 149. The bill requires the comptroller in coordination with the Department of Commerce and the Maryland Department of Environment to conduct a study to assess the total cost of greenhouse gas emissions in the state. The comptroller may hire a consultant to conduct the study. A report on the study findings is due December 1, 2026.
Do I have a second? Senator Washington. So I have Senator Kramer and Senator Washington, all in favor of House Bill 128. Unanimous vote. Thank you.
The committee passed this vote, passed the House bill on March 4th, 7-3.
House Bill 128 favorable. Vice Chair Hayes?
Yes.
Yes. Senator Kramer?
Yes.
Yes. Senator Reedy?
No, not to.
No. No. Senator Ellis? Yes. Senator Mount?
No.
No. Senator Jackson? Yes. Senator Washington? Yes. Senator Guile? Yes. Senator Lamb? Yes. Senator Hershey?
No.
No. Madam Chair? Yes.
Senator Reedy said all that climate change, I hope.
And we already did the Senate bill, right?
We did, we already passed the Senate bill back at the beginning of March.
Can we have next House Bill 1510, Amber, Medical Records Notice of Destruction?
Yes. House Bill 1510 requires that a notice about the destruction of medical record, laboratory, or x-ray reports be made by first-class mail or email. Currently in statute, there is an and that requires notice be sent by both methods. So you do have a reprint on this. It's all of one page that might be mixed in with some things. But there's one amendment that just tries to ensure that delivery of the email, if the contact method for notice is through email, that the email or some sort of delivery receipt is obtained from that email address If not, there has to be an additional notice by mail, but just a guardrail so that providers aren't having to send both methods for every process.
Do I have a motion favorable? Senator Reed, and who seconded?
I'll
Senator
second.
Kramer? Okay, all in favor of House Bill 1510? 10-0. Okay, we're gonna start with David, but we're gonna go to House Bill 102 so that our folks from Department of Labor can leave.
Okay, so if you flip your page, you'll see three bills there, and the first bill was just heard, it's House Bill 102. This is the departmental bill that, as amended over in the House, extends the program, implementation of the family program. Contributions will move from July 1st to, that's the wrong one. Contributions were set to begin this year. It'll move contributions to January 1st, 2027. And then within a year later, benefit payments can start being paid from the program up to December 31st, 2027, or January or something like that. So,
January 3rd, 2020.
yeah. So, other than that, there's some conforming changes in the bill. I don't know if you recall from the House the Senate hearing on the bill, that there was a program for independent contractors. That's struck from the bill, and there'll be regulations eventually to create a program for independent contractors if they want to, self-employed individuals if they want to participate. Otherwise, there are a lot of clarifying changes associated with the delay and other changes to get the program up and running. But most significantly, contributions are delayed 18 months, and a year later, or benefit payments should be coming out of the fund.
Okay. Go ahead. Any questions? Can I have a motion favorable for House Bill 102? Can I have a motion favorable for House Bill 102? That's the Family Leave Act.
Oh, that we just heard?
Yeah,
We
yeah.
just heard. We need a motion favorable, or this bill is going to start, and we're not going to have anything set up for it because we don't have computer programmers and we don't have people, and so I need a motion favorable on House Bill 102.
I'll move for you, Madam Chair.
It's not for me, but thank you. And Senator Washington, did you second? Okay.
It works.
Well, thank you. I know.
Well, you had a bill.
But and I understand that there are people here who don't support this program, but if we don't vote this bill, the program's going to have to start, and it's not ready to start. Is it July 1, 26 or 25, it would have to start taking contributions, right? The way it's written right now, July 1, 25. And you're not ready for July 1, 25.
They're closer to start than 18 months.
I don't know, I thought I had a very simple, easy bill that did the same thing.
I know, so you should vote for this bill since it does.
Madam
Yeah,
Chair,
go for it then, go for it. See ya.
All
She said
right,
she dared you.
I think we better call the roll.
House Bill 102 favorable, Vice Chair Hayes.
No.
No. Senator Kramer.
I'm kind of where Senator Hayes is.
Well, it was his bill many years ago, remember?
I'll roll no.
No. Senator Reedy.
Madam Chair, in the interest of protecting my constituents from a payroll tax that I have fought and think that we could do this so much better if we just contracted with a private sector entity, I am willing to delay this, so I'm voting yes.
Thank you. Well, this is going to be strange.
Senator Reedy, yes. Senator Ellis.
Oh, Lord. I'll pass.
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 Okay.
Senator Mounts.
I'm gonna vote yes.
Yes.
Because you're voting for the delay.
Well, yeah.
And for you, Madam
also
Chair, we're voting for you.
It's also to avert a disaster.
I feel the love.
Yeah, it's also to
Senator
avert a
Jackson?
disaster. People are supposed to be paying money in this thing, this year in July.
Right.
They have nothing, I mean, it's a really bad situation.
Okay. Senator Jackson?
Jackson.
Voting on the delay, I will say yes.
Senator Washington?
Yes.
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 Senator Dial?
I mean, obviously I made the motion, so. But, I mean, I would add, I mean, I do share the same reservations that Senator Reedy articulated, that I just have some concerns about whether this particular model, with all the due respect to the bill sponsor, that whether or not that this is the best way about moving forward with implementation. I believe in this program. I don't really like the characterization of this being a payroll tax. I think it's very important. I think it's important to keep people in the workforce, especially women in the workforce. And I think that our country has historically been so backward on this issue, and I believe in it wholeheartedly, and I would like to see it implemented, but I just concerns that this is the right way about going about it. Anyway, so I'm done. That's a yes. Thank you.
Kind of like all that consumer protection.
Sure, go ahead.
Senator Lamb?
Sure. So to explain my vote, so obviously a very important program. Remember when we first passed it, want to see it come to fruition, recognize that, obviously a lot of challenges, obviously a lot of issues in the environment that have changed since then. So, but I also think that it's important to get this stood up as quickly as possible. I'm not sure 18 months is the right place. So with my vice chair, no. I just have concerns about the timing. I think there are a lot of people that need that help and could be helped sooner.
Senator Hershey?
I don't know, do you need my vote on this one?
No, I think you voted no, you voted no.
You've got 5 to, you're 5 to 3 right now.
5-3,
with one pass.
because I'm going to vote yes.
You
so,
vote yes, you
yeah.
promise?
I promise.
Okay.
Then I will stick with my
Yes.
colleagues, and for all the reasons exactly opposite of my colleague down there, I will vote the same, as yes.
And I vote yes.
You don't want women in the workforce?
Senator Ellis passed.
Senator Ellis?
So what's the vote?
Right now, it's 6-4.
6 to 4, 6 yes?
Okay, 7-4. Thank you, Senator Ellis.
Oh.
All right, you survived.
No more delays.
It's complete
I've
opposite.
had a lot of tough votes this week, but that was maybe the worst one.
Okay.
Okay.
All right. If you want to flip your page back over. We'll resume with House Bill 517 and Senate Bill 401. You have a reprint in front of you. You're second on these bills, and they came over from Budget and Tax. And while the bills were in this committee, the Maryland Department of Transportation got involved, and they talked to the sponsors of the House and the Senate bills. And you have the bill as it came across from the House and the Senate. They struck language in the bill that would have reorganized or started the reorganization of the Maryland Transit Administration. That's all struck, and a work group is established. So if you can go straight to the unofficial copy of House Bill 517, it's the back pages of the reprint, which is the work group. So both Budget and Tax and the House bill that came over were identical, but there are some amendments offered by the sponsor of the House bill and the sponsor of the Senate bill, which would alter the construction of the work group and its duties. You'll see on the back of the reprint on House Bill 517, there are 2 members who regularly use MTA added as appointed by the governor, added to the work group. And then there's a basically rewording on page 7 of the charge of the work group. Study, instead of saying study issues relating to the reorganization of, it adds potential for reorganizing the MTA. And there's a lot of language throughout that changes, adds the word potential rather than just study reorganization. And then at the bottom, there is some language also added to both studies. To the extent practicable, the work group shall analyze alternative reorganization plans, provide cost estimates for any reorganization plan, analyze the impact, potential reorganization plan, and any reorganization plan considered by the work group may not reduce funding for local Baltimore City transit services. There's also intent language in the bottom of the bill. So both sponsors of the House and Senate bill offered these amendments. They're now in front of this committee, and then I believe the Budget and Tax Committee will take these amendments if you pass this bill with these amendments and send it back to Budget and Tax for their reconsideration. And these amendments came from the MDOT working with both sponsors and the governor's office.
Will they be taking the bill to the floor?
Yes.
Move favorable as amended.
Thank you, Senator Kramer. We're doing both bills together. So Senator Kramer favorable, who's second?
Second.
And they're both favorable with amendments.
Favorable with amendment, and second is Senator Hayes. So we are taking the same vote for House Bill 517 and Senate Bill 401. Let's call the roll, Tammy.
House Bill 517, Senate Bill 401. Vice Chair Hayes.
Yes.
Yes. Senator Kramer.
Yes.
Yes. Senator Reedy.
No.
No. Senator Ellis.
Yes.
Yes. Senator Mouts.
I'm gonna be there also.
No. Senator Jackson.
Yes.
Yes. Senator Washington.
Yes.
Yes. Senator Guile.
Yes.
Yes. Senator Lamb. Yes. Senator Hershey.
No.
No. Madam Chair.
Yes.
Yes. 8-3, the bill passes.
One thing I've learned this year is when to call the roll, other than when you puzzle me like you did on. Okay, so, thank you, David. Now we're going to do House Bill 881, Delegate Shetty,
And
and
Senate Bill 703.
and Senate Bill 703.
So these were late bills, but the House passed the bill, and as introduced, the bill would have simply passed through all child support money collected for folks on the state welfare program, which is the Family Investment Program. It would pass through all monies collected for those people on the program as income to them, and it has to be disregarded regarding the calculation of their TCA benefit. The bill came in with an immediately expensive fiscal note, so the House took the lead on it, and they're phasing in. If you go to page 2 of the bill, you'll see that there's a phase-in of how long, several years before you get to full pass-through of the money collected for folks on the Family Investment Program to pass through and then be disregarded, and so they don't get money taken away from their temporary cash assistance. The bill, since it even still has a fiscal note, was over in B&T, and they say they're fine. They have the money for this because the sponsor of the House Senate bill is also one of the subcommittee chairs over in Budget and Tax. So you have the bill in front of you now with no amendments on the House bill, and then the Senate bill would be amended. Senate Bill 703 would be amended to conform to the House bill.
So I have to vote them separately?
Yeah, because one's favorable and the other one would be favorable with amendment.
Sure.
So, reflecting on the testimony, it seemed like individuals were having certain amounts of their child support payments coming withheld and kept by the government,
Yes.
federal and state. And so you're saying if we don't do that, there's a fiscal note attached to it. That means the state will be losing money. Is that is a logical stretch right there?
The state, it's a fairly complicated arrangement that was first established back in 1996. I was actually working on that bill back then. And that was when welfare reform was done. So when somebody comes into the program, the first thing they have to, before they even get on the Family Investment Program, they have to initiate child support collection. If they don't do that, then they're not eligible for the Family Investment Program. So the first thing they have to do is they have to try to collect money from this, in most cases, it's the male head of the male person, the father of the child. They have to try to collect.
Postal carrier.
Yeah. So they have to do that first, and then they go through a whole series of steps before they can be on the program. Back then, some of the money was passed through to the person after they ended up on the Family Investment Program, and other was used to pay for the administrative costs of collecting the child support and other factors. This would allow all of that money to eventually to pass through to the Family Investment Program recipient, and it would not count toward the calculation toward their temporary cash assistance. So yes, the state would have to come up with some other way to pay for the administrative costs. But I don't believe, and I think Senator Hayes, who works for the Department of Human Services, could tell you that not many folks are actually very successful in collecting child support, so it's not as much as you'd think it would be. But yes, the state would have to find some way of covering the administrative cost of collecting child support from the father.
So the ones who do, thank you for that explanation. So the ones who do pay, and say the mother collects for, she's a custodial parent, we're taking some of that money, which is meant for support of the child, to pay administrative costs for the state.
Currently, yes.
Currently. And so we're saying if we don't get that money into the state, it's a higher fiscal note. So we're saying the state needs that money from child support in order to fund state programs.
They'll just have to come up with another source of funds to cover those administrative costs. The department worked on these amendments with the sponsor over in the House, and I believe if you read their testimony, they're comfortable with this approach. And there are other sources of funds they can use to meet the maintenance of effort requirement. Again, it's a fairly complicated set of circumstances that were done back in 1996.
So eventually, the intended recipient of the child support will get all of it?
Yes.
Okay. And what time frame is that according to
Eventually, by fiscal year 2031, all the money will pass through to the Family Investment Program participant.
31.
Enrollee, yes.
Okay. So how many millions is estimated to be collected, say, next fiscal year?
That would be the original fiscal note, but I think if you, it would be 13.9 million annually beginning in 2031 to account for the loss of state share of certain child support collections. So 13.9 million in fiscal 31.
So we can surmise that we're getting close to that now per year to support the program.
Well, the initial hit would be 2.4 million, and it would gradually increase to 13.9 million.
Okay. Yeah,
Of course, that number could change as you move along too, because that's just the current value of money.
Yeah, thank you for that. I'm not sure how much the sponsors negotiated this, and are they happy with this?
Yes.
Okay, well, if they're happy, I guess
And
I'm happy.
Senator McRae has also put in conforming amendments.
Okay, all right, thank you.
Thank you. Senator Mounts?
Yeah, those were long, I was just interested in they said the House had changed the cost. How does that play out? How does the schedule work?
Well, the schedule's in the bill, so
I was asking.
it'd be starting in fiscal year 2020, in fiscal year 2027. So it starts actually in 2 fiscal years. So the current set of circumstances will apply till fiscal year 2027. And the child, it will be the existing, how it exists right now. But then in fiscal 2028, the greater of $100 of any child support collected in a month for one child, $200 for 2 or more children, or 25% of any child support collected will pass through. Fiscal 2029, that moves up to the greater of $100 for any child support collected, $200, and 50% of any child support collected in a month shall pass through. And then fiscal 30, it's again $102 or 75%. The key numbers are the percentages, not the 100 and 200, because that stays the same. And then finally in fiscal 31, all the money passes through.
Yeah, I'm sorry, my question was the cost.
Oh.
Not the cost. So there was an original note that was a certain amount, and then
The fiscal
what
note,
was the original note?
well, the original note would have been about 15.4 million, because that was all the entire amount passed through. So the fiscal note shows that in fiscal 2028, it's going to cost 3.9 million. Fiscal 2029, it's going to cost 7.7 million. 230, it's going to cost 11.6 million. And finally, when all the money is passed through to the mother, it'll be $15.4 million.
And then it would stay at 15.4 on a yearly basis, right?
Well, depending on how, it depends on, who's on how many people are on welfare, but yes, it'll
Okay.
be about approximately
Thank
that
you.
much.
Do you have any other questions? Because DHS is here if we want to bring them up. You want to come up just in case? What's your name?
Hi, Senator Allison, Chair Melissa Bender here for Department of Human Services, and we have worked with both Senator McCray and Delegate Shetty on this bill and are supportive of it. Happy to answer any technical questions.
My vice chair has a question.
No, not of the DHS representative, but for David, I was zoned out at the beginning. We're confirming the Senate version to the House version.
Yes, the Senator McCray has offered amendments, and the bill will be conformed to the House version.
Okay, we don't want to make a habit of conforming our Senate bills to the House version.
Well, they
Got it.
they worked it out first this time.
Yeah.
So we're going to vote on House Bill 881 as.
With no amendments.
Just favorable.
Yes,
House Bill
just
881 favorable.
So moved.
Okay. And a second. So we have Senator Hayes and Senator Ellis. Okay. All in favor of House Bill 881? Do I need to call roll? No, come on. I need to call the roll, Tammy.
House Bill 881 favorable, Vice Chair Hayes.
Yes.
Yes. Senator Kramer.
Yes.
Yes. Senator Reedy.
No.
No. Senator Ellis.
Yes.
Yes. Senator Mount.
No.
No. Senator Jackson. Yes. Senator Washington.
Yes.
Yes. Senator Guile. Yes. Yes. Senator Lamb.
Yes.
Yes. Senator Hershey.
No.
No. Madam Chair.
Yes.
Yes. 8-3, the bill passes.
Thank you. I'd like to use the same vote on Senate Bill 703 favorable with amendment.
Yes, favorable with
Do
amendment.
I have a motion to use that? Senator Ellis and Senator Hayes. Same vote on Senate Bill 703 favorable with amendment. You okay, Tammy? Okay. All right, turn your paper over.
Okay, yes, and so you've already done
102.
102, so let's go to 321. And this is the ERISA bill, which has sat around for quite a while. You have amendments on the House bill. The House sent it over here basically with no changes, and they added study language in the back requiring the Maryland Insurance Administration to study items related to pharmacy benefit managers, specialty pharmacies, and anti-steering. You have amendments offered by Senator Lamb to and let's just go straight to, well, I'll remind you that on,
Do a study?
This was a study, we just expanded it.
this is more than a study. This is not the study. What the senator is offering is, the bill came in making changes to several parts of the law governing PBMs in the insurance article. It maintains the definition of purchaser, which was the whole crux of the bill is introduced. It specified purchaser, which basically would have brought every plan in the state under the provisions of the law governing PBMs in the state, and would have put them under the purview of the Insurance Administration. The amendments offered by Senator Lamb make several changes to the bill. If you go to page 6, you'll see that it removes some of the sections of the law that would have applied to, given the Insurance Administration purview over all plans in the state. But it does maintain the information, the part of the code that deals with prohibition on information that PBMs are authorized to provide, or not authorized to provide or get involved with. But if you see at the top of the page, there was a lot of unions who opposed this bill. So the language on top of page 6 of the reprint would exempt union plans that are with collective bargaining agreements. So they would be exempt from the part that deals with the information part of the code regarding PBMs. But it would allow the Maryland Insurance Administration to not diminish any authority over those who are already regulated by the plans already regulated by the Insurance Administration under this part of the law. So that's the insurance part, that's the information part. At the bottom of the page, you'll see that there's language regarding choice of pharmacy And reimbursement of pharmacies, that's struck from the bill, so the current law will be maintained there. And so the Insurance Administration will still have the ability to regulate, let me go to the back here to get the correct words here. And the fully insured markets. So currently, the Insurance Administration only regulates regarding PBMs, the fully insured market. ERISA plans are generally exempt. So these two sections regarding choice of pharmacy and reimbursement of pharmacies is struck from the bill. So the Insurance Administration's role is maintained only for the regulated market. If you go to page 7, the same amendment exempting ERISA-based union plans, exempting them from provisions of law relating to disclosure requirements by PBMs is also, they're still exempted from that. But again, the Insurance Administration, any other plan that is regulated now would still be regulated under the Insurance Administration. But other self-funded plans would also fall under this requirement, as well as the information requirement, and that would include the counties and local governments and schools that are self-insured. So they would still fall under these new requirements. And then if you go at the bottom, again, union plans are exempted from the audit requirements, and there's language specifying that nothing else, wherever the insurance commissioner has regulatory authority, that will be maintained under current law. But again, the plans, other self-insured plans under ERISA would, again, be brought into these, except for the union plans. And if you go to the back, the audit section is pretty long. If you go to the back of the bill, and the language.
What page?
Go to 12 of 13. There's also an internal review process. Again, the union plans would be exempt from the internal review process under the PBM law, but all the folks like the counties and everybody, the other ERISA based plans would be brought in under this section also. And then finally, in the last page of the reprint, there was the study added by the Health and Government Operations Committee is amended on lines 7 and lines 8. And this was also added to the big study bill that you passed yesterday. And these two sections regarding choice of pharmacy and cost of reimbursement, the Insurance Administration will look in the effect of this section has on pharmacy costs in the fully insured market as it currently exists now, and also regarding reimbursement, the cost is on the fully insured market. The Insurance Administration has agreed to look at these things.
So David, we were emailing with the MIA, and they're okay with these amendments?
Yes.
Okay.
The actual language in the bill regarding exempting the union ERISA plans, all that was worked on with the Insurance Administration to make sure that the original language that was offered would have exempted a lot more than it would cover some plans that they're currently regulating. So it brings them back in.
Senator Kramer?
Thank you, Madam Chair. So, question. Yesterday, we just passed a bill to study this whole issue.
Mm-hmm.
Why are we doing this?
Maybe we're tired of seeing this bill every year, but
Your
Senator, I
mic's
have
not on.
concerns too. I'm just,
Okay, thank you.
I'd kind of like to hold this today and have it, have some people look at it if you don't mind. It's a big change.
It's a lot of change.
Senator?
I'll ask later.
No? Okay.
Senator Lamb.
Senator Lamb?
Sure. So just to be clear, this bill, obviously much more encompassing. We've jettisoned most of the provisions of the bill, except for the provisions, just to summarize here, that deal with consumer awareness, right? So if there's a cheaper drug available, the pharmacist would be able to inform that consumer that there's a cheaper version available. There's a provision that's retained here for auditing purposes, that if the pharmacists feel like they're being gouged or whatever, that, MIA, or that there would be an audit that can be done.
By MIA?
I don't think I think that's not by MIA, actually. I think that's by I have to check on that.
Because now
but-
they can have an audit review, that's already existing.
Right. So there's those two provisions. All the other provisions were generally taken off, and then there was a report there. The work group that was passed in yesterday's bill was much broader, included things like Medicaid, and then there was a small piece that had it look at a narrower piece of ERISA plans. And so this one will expand that a little bit. Probably the same work group will look at it, but this gives it a little bit more purview, I think, for looking at ERISA plans. So everything else in the original bill was taken out. And the unions were exempted, obviously. Yeah.
Okay, so I'm asking to hold it till tomorrow. We still got lots of time.
Lots of time.
Thank you, Senator Lamb.
Makes the weekend interesting.
Okay, and the last bill is a departmental bill that came in late. The House passed the bill, and it's over here now, and it's somewhat related to the state family program. It establishes, it's House Bill 1503, and it establishes a paid family and medical leave program for state employees, all state employees. And essentially, it replaces a couple years ago, you passed a bill that would give parental leave to all state employees. It will replace that program with the more expansive state paid family and medical leave program. And there's some amendments offered in the reprint in front of you. But what the bill does is essentially duplicate the definitions that are in the state law that governs everybody. So family member is the same, deployment, all the definitions are all the same definitions that are in the family program that would be administered by the Maryland Department of Labor. And it leaves most of the program, if you go to page 5 of the reprint, most of the program will be developed through regulations by the Secretary of Budget and Management or the governing body of a public institution of higher education, because the folks over there in higher ed are a little bit different, and the Secretary has no role over their personnel laws. So, but the bill would apply to all employees in state government in the executive branch. So the Secretary or the governing body of the public institution of higher education will adopt regulations governing the program. And most of the changes made to the bill concern bringing in the governing bodies of the public institutions of higher education. And instead of having the Secretary do everything, it just would be a more general, if leave is not taken, the total amount of leave to which the employees may not be reduced, rather than the Secretary would reduce that. So it just changes some references to account for the fact that there are two groups out there that will be administering this program for state employees, the higher education folks and the Secretary of DBM. But
this was a House bill, and the House put the amendments on it.
no, the amendments here for higher education are offered by them, and that's in this bill. So that would be coming from the Finance Committee.
Oh.
For some reason, the House did not put the higher education amendments on, but they were offered during the testimony on the bill.
So if we vote this, it has to go back to the House?
Yes, for concurrence, yes.
Senator Hershey?
Thank you, Madam Chair. Dave, what happens if we don't pass this bill?
Then the state would have to come up. This formalizes a paid family medical leave program for the state. If you don't pass it, they would have to, well, since the program's delayed, they would have a couple years to figure out how they would do this, and they'd probably come back to you next year with another
Yeah,
bill.
but I mean, right now, they're still in the original family leave program, right? That's where state employees are. That's what I just asked.
Yes, they would be, right now, without this bill, well, they're not, I think the state was always going to have a self-funded program. This lays the framework, and apparently they negotiated this with the unions, so it's part of a collective bargaining agreement. But they negotiated, and they actually decided to formalize what they were going to do for the state employees. But I believe the state had intended to not participate and be a self-insured, or self-funded program all along. But yes, right now, they would have to send some sort of notice to labor that they weren't going to participate. And I think they still may have to do that, but this at least puts a law in place that would govern how the program would work for state employees.
Okay, how it would work, but does it implement it sooner than the main program that we just delayed?
This bill takes effect on so this July 1st, 2026, so it takes effect next year. And it would be implemented before the program would be available for private sector and all the other folks who would be subject to the family program.
But because they're not required to do the contributions, because in the state plan, there's no contributions, right?
There would be no contributions. This would be run more like
Just an extended leave program.
You already have a state parental leave program, which is functioning right now. This expands the parental leave program to additional family members and for additional reasons. Parental leave only involves leave, when you have a child. This would expand it to all the other conditions that could, sickness of a sibling or whatever. It'd expand the uses of the leave to other conditions.
So when we talked, I remember many years ago when we were first starting to talk about all these different leave programs, the paid sick and safe leave, I'll give the appropriate term. There was concerns about employees taking advantage of the systems. There's always been that concern. And, again, as you're continuing to expand leave programs, especially, are we just saying that those aren't concerns anymore, that people aren't going to take advantage of this, that no matter how many, different classifications of family and sicknesses and illness, that people are not going to be taking advantage of these things?
Well, there are procedures and provisions in place to govern the request for the leave, how that is dealt with, and if you don't put in a request and it's justified by a certain amount of time, then they can not grant you the leave. That's all spelled out here, and I'm sure the regulations will go more in detail about requesting the leave, justification for the leave. So they did take some of the stuff that was in the program for everybody and apply it here regarding the use of the leave. So.
All right, I'm watching the time. Do we need to hold this or vote it? It's 4:25.
I'll move favorable.
Can we hold it?
Let's call the roll. Yes.
As amended, I believe, is that correct?
Yes, as amended, favorable with amendments.
House Bill 1503, favorable with amendment. Vice Chair Hayes.
Yeah.
Pass. Senator Kramer.
Yes.
Yes. Senator Reedy.
Pass.
Pass. Senator Ellis.
Yes.
Yes. Senator Mounts.
I vote no.
No. Senator Jackson. Yes. Senator Washington.
Yes.
Yes. Senator Guile.
Yes.
Yes. Senator Lamb.
Yes.
Yes. Senator Hershey.
More free leave, I'll vote no.
No. Senator Reedy.
I agree with my colleagues, so no.
No. Vice Chair Hayes.
Yes.
Yes. Madam Chair.
Yes.
Yes. 8-3, the bill passes.
Back to you guys. You guys are the legislators.
One more on the list, and then one more after that I'll explain in detail. So the first bill, this is House Bill 384, as sent over by the House. It is identical to Senate Bill 157. There is one amendment required, however. It's a technical amendment that adds an effective date to the bill.
So, what did we do with the Senate bill?
384. This is House Bill 384 at the top of the list.
We passed out Simon Ayers' bill already. So
You're correct. So the Senate bill has a provision saying that it is contingent on the department certifying that they have staff available by October 1 of 2026, but there is no effective provision making the bill effective October 1, 2025, for example. So this bill will, with the amendment, will correct that, and based on the order of presentment, the legislation will go into effect.
Okay. Motion is favorable as amended, House Bill 384. All right, call the roll. You want me to? Okay.
So the last bill is House Bill 1104. You have a reprint that I passed along and stuck at the back of your packet. So this is a departmental bill that establishes the Population Health Improvement Fund to support the statewide population health targets under the AHEAD model and any successor model. So under the bill, each year, the HSCRC may assess a uniform, broad-based, and reasonable amount in hospital rates to be credited to the fund, which may only be used for statewide population health improvement initiatives. The Department of Health must submit a specified report to the General Assembly by July 1 each year, and electronic healthcare transaction information may be used to support the state's participation in the AHEAD model and any successor model. So there are a few amendments that are being offered by Senator Lamb. Those are on pages 5 through 7 of the amendments, or excuse me, of the reprint, and I'm going to walk through them. So one of the concerns that was raised was the assessment ability of the department to assess funds from the hospitals through the rates that are charged to all payers. Senator Lamb's amendments strike out the provision authorizing the assessment and then move it to page 7 of 7 in a separate section, section 3. And then applies a sunset to that section 3 after 2 years and 6 months. The House sent the whole bill over with a sunset provision after 5 years and 6 months. And so Senator Lamb would leave that 5-year and 6-month sunset in place for the whole bill, which would include the actual fund itself, but would segregate out this assessment authorization and say that after 2 years and 6 months, the department would have to come back and request an extension to that assessment authority. There are a couple other changes. So if you move back over to page 6, you can see that the report requirement that was added by the House is just underlined and not italic. But then the italic provisions beyond line 23 say that the department has to make the draft report available for a period of 30 days, and then in the report, as finalized, include a summary of the extent to which public comments inform the work of the department and the commission. And then finally, back over on page 7 of 7 in section 4, there is another provision that requires the Department of Health and HSCRC to meet with a small group of 6 members of the General Assembly, 3 senators and 3 delegates, appointed by the President and the Speaker, every month through December of 2026. This is in response to some general concerns about the implementation of the AHEAD model and to keep everyone close together so that there is some information being exchanged. I will just note that the final lines on page 7 about the various effective dates and sunset dates are not finalized. And so the provisions that Senator Lamb is offering in these amendments would sunset as I've described them, not as written here. This last provision hasn't been updated in time for the reprint.
Where's the Maryland Hospital Association on this?
Can we answer this one first? Maryland Hospital Association, I just text somebody and said, have they seen them? Have they seen them?
Not that I'm aware of. So
You
these,
just see them. Senator?
Move to hold it because I actually think the amendments probably make this better, but I have a lot of questions about this bill, and I know we're running out of time, so I'll be happy to move to hold it if it's okay.
I know Hopkins is looking at it, but they just were very active today, so we're going to hold this bill. We're going to vote tomorrow. I'll listen to me on the floor whether we vote before we go in tomorrow. Why not?
So that we don't have to be here that early?
Okay, well,
Madam Chair, I'll just point out that this bill, B&T, is second on the bill, and so.
we have to get this to B&T.
And it will need to go back to the House for concurrence.
So maybe 45 minutes before we have to be on the floor, whatever that is.
Oh, I was thinking 30 minutes.
I was agreeing with the chair.
The
Because-
wisdom of Solomon.
Because I think if the Hospital Association blesses it, and we can say that,
That's what I'd like
because they're the ones that are struggling with what's in the AHEAD model.
to agree.
Okay, so.
Can we phone in the vote tomorrow?
Can we phone a friend? What?
Phone in the vote tomorrow?
I think so, but
I think we're probably going in at 11, and this could be 10:30. Yes, we are.
No, you can't, I mean.